Fazio, and welcome back to our second series of interviews with Dr. Paul Canali, the founder of Unified Therapy. Today, we're going to be talking about the Unified Therapy process, specific conditions that it treats, and the overall state of consciousness and how it relates to the healing process. Thank you for joining us. I hope you enjoy. Dr. Paul Canali, thank you for joining us here in Rockledge, Florida at Integrated Bodywork. Welcome.
You're welcome.
Why this therapy, and what makes it so unique?
So unified therapy comes out of the understanding that in healthcare and human development there never has been what we call sort of a unified therapy that everybody can agree on. I sort of modeled the name after, in physics, there's always been this search for a unified theory to explain all the forces in the universe. And all the great physicists and scientists have always struggled with that. But it dawned on me through the years I've been in practice already more than 3 decades, and have been exposed to many, many different things, that there became this point where I started to see sort of a unified connection between what was going on. There are many techniques and modalities, both in physical medicine, both in mental health, but what we were looking for, what do they share in common in a successful outcome, and what happens so often in many other times where the individual who's doing the therapy is not aware of it. As we know often in medicine and in mental health, that so often this unconscious phenomena called the placebo happens, and it's very confusing, and it's even reached down to the very core of almost everything mental health or physicians do, and even the effectiveness of so many of these medications and treatments seem to be more what we call self-generated than what's actually going on. But in Unified, so many different modalities, but could we get people together? Could we get the two camps, people that look for understanding in the psychological, the mental health, a large area also of personal development, evolutionary development, self-enrichment, spiritual development. Do they really share something in common? And if we could isolate this and identify it, supported by a lot of quote-unquote evidence, because that's sort of the catchword now, could we get something where practitioners of all different fields could sort of get on board and make changes in the human condition that were unprecedented? And that's the key thing. They have to be unprecedented, because who would want to join and who would want to be exposed to it?
Let me ask you something though. How is it done, and what's really, what's involved with it?
So I think one of the again, first is identifying what is a really successful outcome. So often in healthcare, the mere absence of a symptom or the lessening of a symptom is seen as a positive outcome. And we're starting to see that type of approach has created huge problems.
Like take my pain away, just rub it out?
Take my pain away, or take my cold away, with a huge overprescription of antibiotics, we've created a serious health problem. Whether it's in mental health or human development or attention deficit, again, we're seeing there's a huge problem where we're subscribing or giving certain things to treat symptoms, and we have these huge healthcare problems. We have this epidemic of obesity. We have an epidemic of attention deficit. We're seeing depression move further down. We're seeing anxiety at epidemic proportions. I mean, 20 years ago, I never saw it. Not one did I ever see a case of anxiety disorder, and I especially didn't see it in young people. And now today, there's not a single week that doesn't go by where a young person, we're just talking middle age or older, but we're seeing a young person plagued by panic, anxiety, and all the related factors. But what's exciting is, which Unified's looking at, is that if we felt that we could make key changes in the relationship between the brain and the body. And this is the key thing,
Yeah.
that we'd have to say this is the age of understanding our brain and nervous system like never before because of imaging devices and other things. So it's helped us practically. It's amazing that sometime in the field itself, to the practical user, this neuroscience seems to have the most value. For instance, like I said, Dr. Ramachandran taking a simple mirror, series of mirrors, but knowing how the brain works and being able to help one of medicine's most plaguing problems was phantom limb pain. So essentially taking a mirror, playing and doing different exercises in the brain in order to fool it in a certain way, to think that you have two hands, you can remove that. And there's many, Todd with his constraint-induced movement. But what we found is it opened up a huge doorway for so many conditions. Pain, the number one condition in the whole world why somebody seeks a physician, especially chronic pain, taking 10 to 20%. And most of chronic pain is unexplained. Unexplained? Yeah, so I hurt myself, I may have twisted my ankle, I might hurt my back, and now it's 3 years later and I'm excruciating pain. In the range of those, in the range of chronic regional pain syndrome, or we used to call reflex sympathetic dystrophy, we're starting to realize more than anything else, it's the relationship, something in our brain, in our body, that the relationship gets disturbed. And the vast majority of diseases seem to begin with that. And I know we're going to talk about this later, but what's so exciting to us and to me, which validates almost a quarter century of work, is this big study, and you can see it on the CDC website, called the ACE study. And ACE stands for Adverse Childhood Experience. And there's different questionnaires, but the basic questionnaire is 10 basic questions, and on there, they're looking at your early exposure to stress and trauma. And of course, we all knew that, yes, a stressful childhood could end up with social problems, emotional depression. That's understandable. But never in our wildest imaginings could we believe that it was going to maybe be one of the major causes or source of chronic disease. So what are we talking about chronic disease? We're talking about diabetes, we're talking about pulmonary lung conditions, chronic obsessive pulmonary disorders, asthma. I mean, for instance, if you had an ACE score, there's 10 possible questions, but say you had an ACE score 4 or more, there's a 390% increase in obstructive lung, that there's going to be this 260% chance or more in conditions like hepatitis and liver disease, a 460% depression, a 1,000% correlation with suicide. This rocks the boat, and it's very interesting because in our work, as we start to see these things, it was exciting, astonishing, but it was also shocking because we felt often that we were alone, you know.